Module 11, Micronutrients. What are vitamins? Well, vitamins are essential organic compounds. So they're essential. We have to eat them on a regular basis because we can't make them. They're organic because they contain carbon. Now, one of the most important points to remember about micronutrients, whether they be vitamins or minerals, is that they do not directly provide us with energy. So in other words, consuming a whole bunch of vitamins or consuming a whole bunch of minerals will not give us ATP. We have to rely on metabolic pathways to do that. Now, the one caveat here is that vitamins are involved in the energy producing pathways, and I'll show you what some of those are in just a minute here. So that's where we should differentiate as far as vitamins and their involvement in energy metabolism. So they don't directly give us energy, so they don't directly give us ATP, but not having them in the metabolic pathways can certainly slow those processes down and limit the amount of ATP that we can produce. So there are several types of vitamins, and basically there are two categories. There are vitamins that are water soluble, so they dissolve in water, and there are vitamins that are only fat soluble, so they only dissolve in fat. Now, an easy way to remember what vitamins are water soluble versus which ones are fat soluble is to use the acronyms that you see over here on the right hand side of the screen. And for the fat soluble vitamins, you can simply use the acronym ADK. So A, D, E, and K are your fat soluble vitamins, while your B's and your C's are the water soluble vitamins. So here are the metabolic pathways put together, and you'll notice along the way here, so for carbohydrate metabolism and converting carbohydrates into glycogen, we need vitamin B6. So without vitamin B6, we're going to limit that production of glycogen. From glycolysis, glucose 2-pyruvate here, we need thiamine, niacin, biotin, and pantothenic acid. Again, they don't directly give us ATP. There's no ATP being produced here from having these vitamins in this process. It's the process of taking glucose and converting into pyruvate that's going to give us ATP. If we move down a little bit more, pyruvate to acetyl-CoA. Again, same vitamins, thiamine, niacin, biotin, pantothenic acid. These are all necessary B vitamins that have to be in place in order for these processes to work. And if you continue to look throughout this diagram, you'll see that these B vitamins are scattered about in all of the metabolic pathways that we discussed earlier in the course. So the point here is that vitamins are a necessary part of metabolic pathways, but they do not directly provide us with energy. So practical application of this is that we can't simply just consume a whole bunch of vitamins or minerals and expect to feel more energetic. Okay, so for minerals, minerals are essential inorganic compounds. So they're essential. We have to eat them because we don't produce them, but they're inorganic. They do not contain carbon. And once again, to reiterate the point, they do not provide us with energy directly. They're not going to give us ATP. So there are a couple of categories of minerals or elements. There are the macro elements or macro minerals, and these are minerals that we need to consume in dosages of more than 100 milligrams per day of these elements. So things like sodium and potassium, calcium, phosphorus, and magnesium would fall into this category. The trace elements or trace minerals are minerals that we need to consume in less than 20 milligrams per day, or you could even use the less than 100 milligrams per day. And these kinds of elements are iron, zinc, copper, chromium, and selenium would fall under these categories. So what does the nutritional status of micronutrients mean for athletes? Why should we care about this? Well, let's use this diagram to iterate a few points here. On the the y-axis here, we have physiological functioning. So how are the physiological reactions occurring? Are they occurring optimally, suboptimally, or poor? On the x-axis, we have low intake, adequate intake, and high intake. So we have the intake of our micronutrients. And this curve, as you go from low to adequate amounts of micronutrients to high micronutrients, is basically a parabola. So at the end of the spectrum here, the low and the high spectrum, we're getting poor performance and suboptimal performance. Whereas if we have just the right amount, the adequate amount of micronutrients being consumed, then we're going to be having our physiological functioning working at optimal. So the idea here behind intake of micronutrients is that we don't want too much, we don't want too little. We want to have just the right amount, somewhere in between, and that's going to give us everything we need to make sure that physiologically we are functioning optimally. The idea again can be viewed using this diagram. So for the intake side of things, okay, so we want to strive for adequacy. Being excessive or grossly excessive or inadequate or grossly inadequate is going to steer us away from physiological functioning that is optimum. As far as micronutrient status is, so once we've taken in the micronutrients, again, the goal here is to strive for adequacy. We know that as we increase our intake, we're going to get compensatory homeostasis, so we'll adjust for the increase in nutritional or micronutrient status. Then that can progress to toxicity, and in some cases that can lead to death. Conversely, if we are below adequacy, we can run into a marginal deficiency and then get into a subclinical deficiency and then clinical deficiency, and then eventually that can lead to death. So we want to strive for adequacy when it comes to micronutrient intake as well as micronutrient status. So how can I assess an athlete's nutritional status? Well, there are four main components that we're going to use. The first of which is all done through diet. So a dietary analysis. We can do a 24-hour recall, which basically, as the name implies, 24 hours later, you're going to assess what the athlete was eating by basically doing asking a series of questions that look at the retrospective 24-hour period. So what did you eat in the last 24 hours? And you try to use that as a way of looking at intake. The problem with that is, of course, it relies on memory. So if someone's not really great at remembering all the details throughout their day, then that may not be the best way to do it. As well as, you have to be completely honest and report everything that you've eaten. Otherwise, none of these will actually be very, very accurate. In fact, research suggests that these can be off by about 25% because people just do not report their true intake accurately. As far as food records are concerned, you could do a food record, and this basically is proactive, and it's giving the athlete some documents that they'll fill out to basically list all the foods that they've eaten for a 3-day period, a 5-day period, a 7-day period. You can use any number of days to assess what the intake for the athlete is going to be. You can look at diet history, so this looks at things retrospectively for a longer period of time. You can use food frequency questionnaires, which the food frequency questionnaire is kind of interesting because it repeats the same type of question, just worded a little bit differently to increase the accuracy of what the athlete is reporting or what an individual would be reporting if they use the food frequency questionnaire. So this, you basically fill out a form asking you questions about your diet, etc. The next assessment that we can do, nutritionally speaking, are anthropometric measurements. Anthropometry is just all about physical measurements. So height, weight, length, circumferences, body fat, or body composition, these are all considered anthropometric measurements. These are physical measurements that we can take. We can, of course, complete a clinical assessment, so we can take a medical history on the athlete as well as perform a physical examination. There are biochemical indices, so we can always analyze blood for specific micronutrients. We can do the same for urine, feces, sweat, and even hair can be used to assess nutritional status. So, why should we care about micronutrients? Why are these of interest to athletes? Well, this table and the next slide here basically show you the micronutrients and where they're utilized as far as areas of emphasis for the athlete. So, for example, you've got thiamine here, or B1, water-soluble vitamin. That's going to be involved, as we saw, in energy metabolism, so it's there as a cofactor. It's also involved in nervous function. It's also involved in muscle contraction. So having thiamine would be of interest to the athlete because, well, they depend on energy metabolism to produce ATP. They have to have a properly functioning nervous system so they can recruit motor units and perform the tasks that they need to for their sport. They have to be able to contract their muscles appropriately. So these are all important components physiologically that relate back to the intake, in this case being vitamins. And so they are concerns for the athlete. So this table is the same for minerals. So you can see that minerals and vitamins are very, very important as far as some of the things that athletes are going to be utilizing for their respective sport. So what are the micronutrient requirements for athletes? Well, unfortunately, micronutrients aren't well studied in the athletic population. We have plenty of data on general populations. However, when it comes to the athletic population, you're more likely to see a research study looking at other aspects rather than just individual micronutrient needs, etc., of athletes. So basically, the best practice currently is to use a reference guide, and that reference being the dietary reference intakes, or the DRIs, for the micronutrients. Unless there has been some work on a particular micronutrient, for example, calcium and iron, we've got a lot of data on the athletic population that we could rely on those papers compared with the DRIs. But if you can't find something in the scientific literature regarding a specific nutrient that you're looking at as far as vitamins and minerals are concerned, the DRIs are your next best reference. And again, it's just a reference, just a point to start with. So, and the reason why the DRIs can be applied here generally for athletes is that there is a wide margin of safety. So about 98% of the population is covered using the DRI tables. The most important thing in my viewpoint is this right here, and that is if the athlete is consuming a nutrient-dense diet, then with adequate kilocalories, then micronutrients really shouldn't be a huge issue for the athlete. There are some specific circumstances that we'll talk about here in just a second, but as long as we've increased the overall caloric need to match what the athlete is expending, and we're trying to make sure that the athlete is consuming nutrient-dense foods, meaning they're not going to McDonald's for all their meals and not getting all of their micronutrients, then this really shouldn't be a tremendous concern. Where we do have some concerns is, as I mentioned earlier, is calcium and iron. These seem to be some problematic areas, but again, it relates back to the issue of marginal deficiency, inadequate intake, and less of an issue that, well, this is an athlete, and because they're an athlete, they're going to have these issues. So it's more about the overall kilocalorie and nutrient density of the diet that they're consuming. So how does deficiency affect performance in athletes? Well, again, as I mentioned, we don't have a lot of work done in this area, so we're not quite 100% certain as to how this might affect the athlete or if this is even a real problem. As far as some of the work that has been done out there on vitamins, with thiamine, a subclinical deficiency increases the exercise-induced blood lactate concentrations. If you recall, lactic acid levels, as they increase, the more that they increase, and if they increase behind or to a certain point of the lactate threshold, then you're going to have a decrease in performance. So there may be the issue of diminished endurance here by not having thiamine in the diet. But again, we don't have a lot of work in this area, so we're not quite sure whether there's an appreciable effect here. As far as vitamin B2, again, a subclinical deficiency here might affect muscle metabolism, might affect neuromuscular function. We're not quite sure. A marginal deficiency you probably can get away with without too much effort there. As far as vitamin B6, again, no change in performance here with marginal deficiency, perhaps being inadequate and subclinical. That may present some problems for the athlete, but we're not quite sure. Vitamin C, we've got a couple of studies that are saying basically opposite things. So again, we need more work in these areas. With a combined deficiency, which is more likely what you'll find in someone who has a poor diet, is that you're going to have a combination of micronutrients that are going to be depleted and inadequate in their diet. So as this case of, in this case where some of the work was done, thiamine, riboflavin, B6, ascorbic acid, these were all reduced, and this did in fact reduce aerobic capacity. So there may have to be this combined effect in order to see any sort of real and appreciable differences in exercise performance. As far as minerals are concerned, iron, without question, across the board, is one of the most problematic nutrients for humans. And for an athlete, this has been well studied. And what I'm going to briefly say here, since we have a module later on in the course, is that iron deficiency definitely leads to decrements in exercise performance. There's no doubt about that. As far as zinc is concerned, there's some evidence to suggest that endurance performance may actually be reduced here, and the mechanism involved may be through lactate dehydrogenase. This is an enzyme that is going to convert pyruvic acid into lactate or lactic acid and vice versa. And so it may be a zinc-dependent enzyme. We're not quite sure. So why do athletes use micronutrient supplements? Well, the main reasons are going to be to enhance recovery and to improve sports performance. So are micronutrient supplements necessary? In general, no. As long as the athlete is consuming overall sufficient amount of kilocalories and they're eating a variety of nutrient-dense foods, then we don't really need to worry too much about micronutrient intake. However, as we've talked about in the past, sometimes being an athlete means that you've got this really rigorous schedule, you're traveling a lot, and it may be difficult to get sufficient amount of kilocalories. It may be difficult to consume nutrient-dense foods on a regular basis. So is taking a multivitamin a bad way to go? No, absolutely not. Taking a multivitamin would be a great way to fill the gap in somebody who's having a little bit of trouble consuming sufficient kilocalories as well as consuming nutrient-dense foods. So in general, no, but of course, this is all on an individual basis. We need to look at the athlete and find out what their training schedule is, find out what their training status is, as well as their training regimen in order to make better recommendations for the athlete. So when would we supplement an athlete? Well, of course, number one here, a normal diet is just not able to maintain an adequate amount of micronutrient status. Again, bioindividuality is very, very important. If micronutrient status needs to be improved and physiologic function is improved because of an improvement in nutritional status, then we have to provide some sort of supplement. If we see a significant improvement or enhancement in exercise performance, then of course we want to provide the athlete with a supplement. So again, individual basis, we need to ask the appropriate questions. We need to make sure that we're performing an appropriate nutritional status and evaluating the athlete on a case-by-case basis to make best practice recommendations. So is there any scientific evidence for micronutrient supplementation in non-deficient athletes? So can we take an athlete that's doing everything beautifully as far as the diet is concerned and then add any value by consuming supplements? Well, as far as what has been shown in the literature, thiamine and riboflavin don't seem to provide anything as far as improvement is concerned, but peroxidine or vitamin B6, there seems to be some mixed results there. In some cases, it may actually stimulate growth hormone, but we're not quite sure if that's going to translate into anything appreciable as far as exercise performance. As far as folate is concerned, there didn't seem to be anything there. Interestingly, when you take a B1, B6, and B12 supplement in one of the studies that was evaluated, it seemed to improve target shooting performance. So whether or not that was some sort of anomaly in that particular study, maybe perhaps a placebo effect, we're not quite sure. So that would need to be evaluated further. As far as other B vitamins, again, there's very limited work in this area with athletes, so we're not quite sure as to what we should recommend for the other B vitamins. Okay, as far as vitamin C is concerned, this one actually has been fairly well studied, and where it's been well studied for is in URTI, or upper respiratory tract infections. And with an increase in vitamin C intake, particularly in ultra endurance athletes, so these athletes that are going out and training for 3, 4, 5 hours plus, so strenuous physical activity, that seems to help with the incidence of URTI. You can actually reduce the risk of infection with a supplement of vitamin C within the 600 to 1,000 milligram per day zone. So really what we're trying to get at is protecting against reactive oxidative species with heavy exercise. And we'll talk a lot more about reactive oxidative species, etc. once we get to that section in the course a little bit later on. As far as vitamin E or alpha tocopherol, doesn't seem to improve aerobic performance. And as far as muscle damage is concerned, because there was a lot of work looking in this area, it doesn't seem to be well supported. This could very well be as a result of just poorly designed studies. So we're not quite sure. We need better work in this area to make a better assessment of this. As far as vitamin A is concerned, as far as the retinol, the active form of vitamin A or D or K in athletes, there doesn't seem to be any data that's supporting anything appreciable at this time. Iron, again, we know for sure that iron deficiency can present problems, and overconsumption of iron certainly can present problems as well. So we need to hit that adequacy level in order to maintain appropriate performance. Magnesium doesn't seem to have any effect. Chromium doesn't seem to have any effect. And other minerals really haven't been studied all that well other than iron. So iron's the big one with athletes. So are there any toxic side effects of micronutrient supplementation? Can you overconsume them? Well, with the water-soluble vitamins in general, there doesn't seem to be too much of a side effect. However, there are a couple of exceptions to the rule here. So with B1, B2, there doesn't seem to be any side effects. However, with vitamin B6 or peroxidine, you can get some sensory neuropathy from having an excess amount of B6. So we do need to be careful about this and not consume more than 200 milligrams per day of vitamin B6. With folate, what can happen is that can actually interfere with zinc metabolism and upset zinc balance. So we want to make sure that we're not over-consuming folate as well. So a safe dose, 50 to 100 times the DRI value, so that would be the RDA value would be 400 micrograms per day. So that's a pretty large amount that you can increase in folate and still not run into these issues with zinc metabolism. B12 or cobalamin, this is safe upwards around 10,000 times the DRI value. So not that we would recommend it, but again, there's a large safety margin here. With nicotinic acid, 5 times the DRI value, and it seems to be fine. However, with the larger doses, it may actually block free fatty acid release from adipose tissue, so that would limit the availability of adipose or triglyceride available and fatty acids available for ATP production. So that may have a negative impact on exercise performance. Biotin, pantothenic acid, doesn't seem to be anything there as far as toxicity. Vitamin C, we know that high doses, more than about 1 gram per day, that can lead to oxalate stones, increased uric acid production, diarrhea, B12 destruction, and iron overload, since vitamin C does enhance iron absorption. With the fat-soluble vitamins, as far as vitamin A is concerned, it's kind of dangerous to consume the active form of vitamin A. Retinol, retinal, and retinoic acid would be the 3 forms of what's called preformed vitamin A, or the active form of the vitamin. That can lead to joint bone pain, hair loss, anorexia, which is just a lack of appetite. This is not the eating disorder. So anorexia just means lack of appetite. Liver damage, 10 grams per day would be the high limit that you could consume here. And in female athletes, this can actually cause a spontaneous abortion and birth defects. So we want to really be careful with the active form of vitamin A. A better route would be to consume something like beta-carotene, which is water-soluble and is completely non-toxic. About the worst thing that can happen is that since it is stored under the skin, your skin will turn a funny shade of orange-greenish. So it might work actually for a Halloween gag, if you're so inclined. As far as vitamin D is concerned, this is potentially a toxic vitamin. However, there's so much work that has recently been done on vitamin D, and it seems like vitamin D is almost going to be the panacea to cure just about every single disease out there, the way the literature is supporting vitamin D. But you're going to see some changes in vitamin D recommendation as far as the amount that we should be consuming on a regular basis as a result of the new work that's been done. For athletes, again, consuming vitamin D, we still have to be cautious, and we don't want to overconsume it just because we don't know what the effects are going to be. So the problems here, hypercalcemia. So you'll have an elevated level of calcium. That can lead to calcium deposits, so you get soft tissue calcification. Hypercalciuria, which is an increase in the amount of calcium in urine. Anorexia, again, this is just a lack of appetite. This is not talking about anorexia nervosa, which is the eating disorder. Constipation can be a problem, and irreversible renal and cardiovascular damage. And so we don't want to exceed 10 times the RDA to prevent the DRI to prevent some of these effects. A high calcium intake may also enhance the toxicity, so we want to be careful, since the recommendation now is for calcium supplementation to be paired up with vitamin D as well. So we just want to be cautious. Vitamin E doesn't seem to be toxic, and it seems to be safe at about 100 times the DRI value, so that's 1 gram per day. As far as minerals are concerned, mineral toxicity tends to be rare simply because we can excrete minerals fairly easily. However, again, we do want to be careful and not go overboard and push the dosage of minerals up beyond what's necessary. Zinc can lead to, if we have too much of it, at least 4 grams of consumption, which is a huge amount, can lead to emesis, so vomiting, diarrhea can be induced by this. Copper can cause liver necrosis and hepatic necrosis, liver cirrhosis and hepatic necrosis. So that's a problem. We don't want to overconsume copper and then have these problems, because we definitely need our liver for quite a number of things. Selenium. This can result in skin and hair changes and even loss. Some neurological abnormalities can happen as a result of this. So the threshold for selenium is just above the DRI, so we really want to be careful with selenium intake. High intakes of zinc. One of the interesting things to remember is that zinc Iron and copper are very closely related. These are metallic substances. They're involved in metalloenzymatic reactions, and they are tightly related. So if you upset the balance of one, for example zinc, then you're going to upset the balance in iron and copper. And you can kind of interchange all of these things. High intakes of iron and copper can interfere with the zinc absorption. So we have to be careful and not upset the balance of these three micronutrients. So in general, the rule of thumb here is just a high mineral intake can interfere with nutrient absorption. So we want to be careful, err on the side of not exceeding 5 times the DRI recommendation.